Has your doctor told you that you've got adenomyosis? And you're thinking, oh no, what in the world is that? And even worse, if you are trying to fall pregnant, you will certainly have an additional question, which quite simply will be, how is this condition going to affect my ability to fall pregnant? That's exactly what I intend to address in this video. I'm going to tell you what adenomyosis is, how it can affect your fertility, whether or not you can still fall pregnant if you have this condition, and how it is treated. Stay tuned. Hi everyone, welcome back to Hey Doc with me, Dr. Kady. I am a board certified family clinician. On this channel, I talk about pregnancy related issues. I leave no fertility topics unturned, untouched, unaddressed, and I also love women's health, and therefore we talk a lot about women's health right here on Hey Doc. If this type of content tickles your fancy, make sure that you subscribe, you like, and help us to get our message out there by sharing it with people that you know and your loved ones. Diving right into the topic. Adenomyosis is basically a condition in which the endometrial lining, which is basically the lining that coats the uterine cavity. So it's the tissue where the baby that would be growing inside of your womb will be surrounded by. It will be surrounded by endometrial tissue. It is when this endometrial tissue extends into the muscle wall, which is known as the myometrium, and this is the muscle wall that forms the bulk of the uterus. Adenomyosis is like endometriosis. In fact, it can very often coexist, but with endometriosis, the endometrial tissue is found outside of the uterine cavity. But with adenomyosis, just think of it, it is still within the uterus, but deep sited within the myometrium, which it is not supposed to be in. In the myometrium structure of the uterus, there is just supposed to be muscle tissue and no other tissue is supposed to be found there. The symptoms of adenomyosis include painful periods, heavy menstrual bleeding. It can also cause the woman to have chronic pelvic pain, and sadly for some women, particularly when adenomyosis is severe, it can lead to fertility challenges. Adenomyosis can impact fertilities in several different ways. Let's consider the different ways in which adenomyosis will affect fertility. Before we do, can I check, have you heard enough to make you like this video? And is this video worth sharing with someone that you know is struggling with infertility? Well, what are you waiting for? Make sure you subscribe, like, and share. It will allow more people to come into the knowledge of this free and very useful information that we share right here on Hey Doc. So back to the ways in which adenomyosis affects fertility. The first way is that it causes uterine inflammation. So the inflammation of the myometrium itself creates a hostile environment for the implanting embryo, but also the inflammation of the myometrium can also affect the state of the overlying endometrium. And as we know, the endometrial lining itself can also become inflamed. So inflammation within the myometrium is bad news because it's not just limited and confined to inflammation within the muscle bulk, but it will also affect the endometrium, thereby making it very difficult for implantation to occur. Even when implantation does occur, the ability of the implanted embryo to remain attached will be affected by the inflammation that is going on within the myometrium. Adenomyosis will of course disrupt the uterine structure. It will make the uterus more bulky, and the structure of the uterus as well as the structure of the uterine cavity itself will become distorted. This abnormal thickening not only interferes with implantation, but it also causes an increased risk of miscarriages. A bulky uterus is never good news, particularly if you are trying to get pregnant. Why? Because an enlarged uterus that is filled with endometrial tissues within the myometrium is likely to have a reduced blood supply to the endometrium, thereby reducing the likelihood of successful implantation from occurring. And for a growing fetus, reduced blood supply to the uterus can lead to intrauterine growth restriction. Another way in which adenomyosis can affect fertility, it has been found that patients who have adenomyosis have a high estrogen level, and persistent high estrogen levels will prevent ovulation from occurring. So the effect of adenomyosis on fertility is not limited to its structural impact on the uterus, but is also able to prevent ovulation and thereby fertilization from occurring. And finally, due to uterine dysfunction, I have mentioned this before, but I'll reiterate, adenomyosis has the likelihood to increase the risk of miscarriages. Can you get pregnant with adenomyosis? The answer is yes. Many are the women who have been able to conceive naturally with the diagnosis of adenomyosis. However, some do face difficulties, particularly when the condition is severe. If you are a woman who suffers from severe adenomyosis, do not lose hope and do not throw in the towel, because there are treatment modalities out there to get the condition under control in order for you to be able to conceive. There are 3 different treatment methods for this condition. The first way to treat adenomyosis is with the use of hormonal treatment. And in this class, we have the use of birth control, we have progestin therapy, and all these help to manage the symptoms whilst shrinking the endometrial tissue that is found within the myometrium muscle bulk. The second way to treat adenomyosis is surgically, and this procedure is called adenomyomectomy. And quite simply, the adenomyotic tissue is just removed. And finally, if you have severe adenomyosis, one of the ways that you can conceive, which I consider to be a third treatment option, I guess, particularly when you're trying to conceive, is for you to go through assisted reproductive techniques, such as going through IVF. So you have adenomyosis, you're trying to get pregnant. When should you seek help? Look, if you are actively trying to fall pregnant and you have been at it for 6 months or more, I would say now is the time for you to seek help. Once you get told that you have adenomyosis, usually this will be through the means of an ultrasound scan. Very often we can tell the extent or how severe the adenomyosis is. So by all means, ask your doctor, is it mild, is it moderate, or is it severe? If your doctor is telling you that it's severe and you want to have fallen pregnant like yesterday, then you need to go and see a fertility specialist immediately, or rather a gynecologist if you're told that it is severe, because you might need an additional 6 months to get it under control for most of you, so that the uterus is less bulky and reducing the chances of complications once you fall pregnant. So see a doctor ASAP if you've been told that it's severe and you are keen on getting pregnant. If you feel like you've got a bit more time in terms of you're not in a hurry to get pregnant, then I would wait another 6 months. But in that 6 months, I wouldn't just be passive. I would see a doctor, a gynecologist, and find out what treatment you can get to be proactive about getting your uterus to a normal shape or to a normal function, less bulky, so that when the time comes when you are actively trying, you have already done all the needful as it relates to the condition. However, there is a group of patients out there who have suffered miscarriage after miscarriage and after miscarriage. If you are a woman who has suffered recurrent miscarriages and you just don't know why it has happened, I would argue after the first miscarriage, one of the things that all fertility specialists should do, or your doctor should do, it could be your general family doctor, it could be a gynecologist, you should at least get an ultrasound scan of your uterus. And so if you've had a miscarriage and it is identified that one of the reasons, or the reason that you may have had a miscarriage, is because you have adenomyosis, obviously, ladies, before you try again, make sure that you get treated. Not everyone has to go for surgery. You only go for surgery if it's really extensive, but you might just be fine being treated with a GnRH agonist and waiting a couple of months before trying again. For those of you for whom pregnancy is not an issue, you are good. You are good with however many children you have or with no children. You are straight. But the bother is the symptom, which is heavy bleeding, irregular periods sometimes, chronic pelvic pain. For those of you, if you are getting this type of symptoms at any stage, just know that one of the reasons that you may be experiencing this symptom may be because of adenomyosis. See your doctor. Because of the hormones found in birth control, it can keep your symptoms well under control. Thank you for watching. Remember to subscribe, to like, and to share our videos. Thank you, and we will see you in the next one and the next one by God's grace. But in the meantime, there's plenty of other videos for you to feast on right here on Hey Doc. Take care, and we will see you later.